heard one, if not all three of those names. At the end closest to the ovary, there's these little finger-like projections, and those are called fimbriae. Okay? Now you can see the ovary and the fimbriae and the oviduct on this side. You can see it on the other side as well. Okay? So this again is going to be where the uterus is. This is the ovary. This is the oviduct, uterine tube, or fallopian tube, and these little finger-like projections are called fimbriae. This blue structure right here is the pubic symphysis, which you probably remember from your 131 days. That's that piece of cartilage that attaches the two pubic bones. That is relevant in terms of the female, much more so than the male, because of the pressure that's exerted by the fetus directly moving down. So the fetus will be here in the uterus. This is the uterus. Here's the urinary bladder. As the fetus enlarges, put pressure on the urinary bladder, and therefore put pressure there on the pubic symphysis. The two pubic bones will end up pushing together very tightly, okay? And that'll put pressure on that pubic symphysis. Now that pubic symphysis is made of the same material, called fibrocartilage, that the intervertebral discs are made of, okay? So it's going to resist a lot of forces. And one of the things that they recommend to pregnant women that are experiencing that tightness or that tension right there on the pubic symphysis is to actually elevate their legs and sit almost in a foot-to-foot fashion like this and allow their knees to extend outward, okay? And that will relieve the tension right there in the pubic symphysis, because a lot of women experience pain right there. Next, we are going to talk about the labia majora and labia minora. The labia majora is going to be the larger and is going to be more superficial. The labia minora is going to be a bit smaller and a bit more internal. Absolutely, yep. And right here I have it on the list, labia majora and labia minora. I'm trying to go down the line. Okay. Here we are looking at the labia minora. That's this right here. Okay. And then these purple structures right here are glands. Okay. This gland right here is called the greater vestibular gland. Okay. And the job of that is to lubricate the vagina. Okay. The purpose of that is to lubricate the vagina. So as we open this up inside, again, this is the labia minora, this is also the labia minora right here. As we look inside, this is the urinary bladder right here, as we talked about before. The bumps inside of it, again, are called what? Rugae. The muscle that it's made of is called the what? Detrusor muscle. Good. This little tube right here is going to be the urethra. And again, the urethra is what's going to allow for the passage of urine. Okay, so that's the urethra. Next, we have the ureter. Well, one thing to take note of is this is the kidney right here. For those of you who can't see it, I'm going to twist it all around so hopefully everybody can see it. If you can't see it, please let me know. Politely, of course. Extending inferiorly from the kidney, we have a tube that moves down and heads toward the urinary bladder. The name of that tube is the ureter. So that is the ureter. Next, if we move directly anterior to the labia minora, we have this structure right here, and that is the clitoris. The clitoris is involved in sexual arousal. Increased blood flow, very similar to that which we see in the penis, is going to increase at that area and become more sensitive during sexual stimulation. Next, we have the vagina. This area right here is the vaginal opening, and this open space right here is the vaginal canal. So we have the vaginal opening and the vaginal canal, and the whole thing makes up what we call the vagina.
Where's the canal?
It's the empty space right in the center. So the vaginal opening is here, and the vaginal canal is there. Here we have the uterus. From here to here is the uterus. If you take a note, you'll see that there are some bumps right here in this first part of the uterus. Okay? This first part of the uterus is termed the cervix. So this is the cervix. So if I was to ask a question, what do we call this part or this structure in between the sticks? The answer is what?
Cervix.
Cervix. Good. A lot of people have a tendency to believe that the cervix is actually a separate structure from the uterus, but it's just the proximal, or actually distal, depending on which way you look at it, but the entrance or exit of the uterus. Okay? Again, the uterus is a blind pocket, so that's what you should be thinking of right there. So this right here, again, is the cervix. The opening to the cervix that leads into the vaginal canal is termed the external os. It is termed the external os. Os means opening. So that is the external os. As we go deeper into the uterus, the end of that bump, right where I am right now, that is the last of the bumps right there, is going to be the internal os. So here is the external os, and here is the internal os. The internal os is the last piece of the cervix before you enter into what we call the uterine canal. This empty space right here is termed the cervical canal, and this piece right here, this opening area right here, is termed the uterine canal. So what's the space here? Cervical canal. What is the space here? Uterine canal. What is the name of the structure here? Cervix. What is the name of the opening here? External os. What's the name of the opening here? Internal os. Now, when we're talking about the uterus, we have 3 layers to the uterus. We have the endometrium, we have the myometrium, and this is actually 2 layers of the myometrium. And the reason we have 2 layers to the myometrium is because we have 2 different types of muscles there. So this right here, this lining on the inside is termed the endometrium. We have 2 layers of muscle right here called the myometrium. And on the outside, we have the perimetrium. So I ask you, what is the name of this layer here? Your answer is the what? Endometrium. If I ask you, what is the layer here? You call it what? Myometrium. You say, what's the layer here? You say what? Myometrium. You say, what's the layer here? You say what? Perimetrium. Good. Now, if you look right here, in the junction between the myometrium and the perimetrium is going to be blood vessels. You'll see arteries and you see veins, and that's obviously going to be very important in terms of regenerating the endometrium, which we will get into in lecture and touch on a bit in here. Okay? So again, make sure you know the layers, make sure you're aware of that this is a vascular tissue. Here we have the endometrium, myometrium, and perimetrium. You should also understand that this is the uterine canal. Now, on the other side, we do have the uterine tube, okay? We had the ovary right here, the little pieces of, all I'll do is reiterating what I first started off with. This right in here is going to be the yellow structure is going to be the ovary. The finger-like projections right here are going to be the fimbriae, and this structure that extends along here is going to be the oviduct, or uterine tube, or fallopian tube. As we see, there is a ligament that actually is going to attach the ovary to the uterus. This is not going to be well seen from where you are because it's a very small structure, but I will try to turn it around so that everybody can see it. Very slowly turn it around. It connects, again, the ovary, which is in yellow, to the uterus, which you've seen already. The name of that ligament right there, which you should add to your list, is going to be the ovarian ligament. That is the ovarian ligament. The ovarian ligament, again, is going to connect the ovary to the uterus. Next, we have a ligament that is going to connect the uterus to the anterior abdominal wall. The name of that ligament, which is right here at the tip of the pointer, is known as the round ligament. So right here we have the round ligament. This is the round ligament. And it connects the uterus to the anterior wall. Connects the uterus to the anterior wall. Then we have this structure right here. It looks like an extension off of the parietal peritoneum, and it is, and the name of that is called the broad ligament. B-R-O-A-D, broad ligament. So you should add to your list, the broad ligament.
What is that?
The broad ligament, B-R-O-A-D, and it's going to be extending along the lateral, anterior, and posterior walls of the abdomen and pelvic region. Really the pelvic region. But I'm not focused on that, I'd rather just know where it's located.
And that comes off the parietal peritoneum.
It's a piece off it, yes. Next we have the mons pubis. This is the mons pubis here, and this is the mons pubis here. Notice that the excuse me. Notice that the mons pubis is the color of fat, and yes, it is fat. It's primarily adipose tissue. The mons pubis is there for protection during intercourse. It is for protection during intercourse. That is the purpose of the mons pubis. It is obviously more pronounced in females than males. And males in some books will say that males do not have a mons pubis. In other books it'll say that males do have a mons pubis, it's just not as pronounced as the females. Okay? The mons pubis becomes more pronounced after puberty. And that takes care of the female reproduction. Here we have the male reproductive system. To go through some of the similar structures, because there are some similar structures here, we have the rectum back here. We also have the kidney right here. And then that tube that extends down from the kidney is the ureter. Here we have the pubic bone. Here we have the pubic bone. And this blue structure, just like in the female, we have the pubic symphysis. Okay, in blue. Okay. Again, I'm going to go with the some of the similar structures first. Then we'll just head straight on down the list. Here is the urinary bladder. If I ask you what is the name of the muscle here, your answer is detrusor muscle. If I show you the bumps right here and I say identify the bumps, your answer is what? Good, rugae. Okay. Back here is the sigmoid colon. So in the way of similarities, that is pretty much it. The rest of what we're going to talk about, I'm just going to head straight on down the list. Okay, try going to the bladder. Don't worry about try going to the bladder on this one. Make sure you know it on the ones we did last week. So in terms of overall structures, I'm actually going to start a little broader and then start working down a list. Here is the penis. Just to give you an idea of what we're talking about. Here is the penis. Here is the testes. This is the prostate gland. Here again is the urinary bladder. So urinary bladder, prostate gland, and then here we have the penis. Okay? Here's the testes. So again, working from top to bottom. First, we're going to talk about the prostate gland. This is the prostate gland right here. The prostate gland releases a fluid that is alkaline. It is the first fluid to be released just prior to ejaculation. Now there is another type of fluid that is released from these glands right here, and in some of the other models, I could actually turn around. Can you hand me a male reproductive? Just actually show it to me first. It should be the same. Yes, we can have that thing. The reason I'm just doing this is just to show you that that little white dot that you see right there is also represented here. Okay? The name of that gland is called the bulbourethral gland. That bulbourethral gland, which is there and there, I'll wait for you. That bulbourethral gland secretes a fluid called pre-ejaculate. And it happens sometime, and when I mean sometime, I'm not saying it's in questionable time, I'm saying in a excited state, the beginning of the excited state, that the bulbourethral gland will secrete this fluid down the urethra, okay, and release that pre-ejaculation. Now that's done for two reasons. It's one, to decrease the acidity or neutralize the acidity of any urine that's still remaining inside of the urethra. The second is for lubrication of what we call the glans penis, which is also termed the head of the penis. But you must know it is the glans penis, which is this area right here. So this is the glans penis. This is also the glans penis. This right here is the glans penis. This is the shaft of the penis. So we have the shaft of the penis, and we have the glans penis. So again, the bulbourethral gland will secrete that fluid along here and neutralize the acidity of the urine there, as well as to provide some lubrication at the glans penis. But it is limited.